Welcome back to the AI Revolution Learning Series with our focus on healthcare. Our series has taken us from AI research laboratories to clinic floors, from ethical frameworks to transformation realities. And now we synthesize what we've learned about AI's potential and pitfalls, and we answer the question, where do we go from here? Our topic today is the future of AI in healthcare. I'm your host again, Carrie Purcell. And today I'm joined by a panel of experts covering this topic from perspectives spanning research and innovation to product development, from pharmacy to physician and AI founder perspectives. We'll cover the critical gaps that we must close today. We'll talk about what success looks like in 2030, and we'll talk about the bold moves that we need to make to get there. But first, let's get to know our panel. So today we have joining us Saba Siddiqui, who is an AI research lead at the Durham College AI Hub. We have Dr. Glenn Loomis, who's a physician and CEO of Carrie Health. Glenn has developed an AI agent system supporting patients and physicians, who you've heard earlier in our series. We have Natalia Haluszka, head of brand and product development at Adore Eyes, which is a Canadian luxury cosmetic line that uses AI in skincare analysis. And again, we have joining us Jaspreet Chager, who has a pharmacy background and is also founder at chager.org, where she supports SMEs and women leaders in AI literacy and adoption. So I want to welcome everybody today and thank you for joining us. And I'm going to go around the panel and give everybody a minute to introduce themselves, talk about your roles, and just let everybody know a little bit more about your background. And we'll go in the same order. So starting with Saba.
Hello. So thanks for the introduction, Carrie. As you mentioned, I work as a research lead at AI Hub Durham College. I've been working in AI space for a decade now. I started as an AI developer. Lately, I've been more focused on helping industries adopt AI, helping them understand the feasibility of solutions they're trying to implement, and then making sure the solutions they're implementing are scalable and responsible, because in the last couple of years, AI has changed drastically, and it's important to understand we are doing it all ethically. So yeah, thank you.
I'm Glenn Loomis. I'm a family doc by background. I'm the CEO of Carrie Health, where we've developed an AI agent that talks to patients and gives doctors a good idea of what's going on with the patient, including sort of diagnosis and treatment plans.
Thanks, Glenn. Natalia.
Carrie, thank you so much for inviting me to this podcast. My name is Natalia Haluszka. I'm the co-founder of Adore Eyes. We manufacture medical-grade cosmetics. We actually develop ingredients as well, locally sourced from Niagara region wineries. And just recently, we entered the world of AI with our Skin AI software, for which we won AI Impact Awards this year. I actually do have a background in tech, have been there for many, many years. So this is my bridging back to the world of tech through the AI, and I'm very happy to be here.
Wonderful. And Jaspreet, one of our co-hosts and collaborators on this series. Welcome back again.
Thanks, Carrie. I'm so excited to be here. Like Carrie mentioned, I'm Jaspreet. I'm actually one of the co-authors as well on the AI Revolution and owner of chager.org. I have 20 years of healthcare experience, and I specialize pretty much in the hardest part of AI implementation, which is not necessarily building the technology, but getting clinicians to actually use it effectively and safely. My focus is really AI literacy, change management, and building really that organizational capacity in healthcare systems that is needed to move from really pilot to sustainable practice.
Amazing. Thank you. So we really are going to cover the span here from those early research and innovation stages where Saba can really talk about support there. We have successful product launches with Natalia and Glenn, and we have that real world implementation perspective from Jaspreet. And I'm sure everybody has a little bit of overlap there as well. Starting on that research side, so when we look at critical gaps that we have to close today, a lot of times it can take years, even decades, for AI research breakthroughs to reach patients. and really get implemented. So I want to start with Saba with that question. Why can it take 5, 10, 15 years for those breakthroughs to actually come into commercialization and into the hands of users?
There are quite a few reasons for that. The main reason here, especially in the AI space, is the data. As we know, to have better models, we need to have proper data. Unlike other fields where we have a continuous supply of data and less barriers, healthcare is a little bit different. You can think of it as we have standard models in other sectors, but when you look at humans, we don't have a standard human, right? We are collecting information. It's not continuous. You have gaps there. And then the way you're collecting it, there is a bias. There is a bias depending on the regions you're collecting it in, the conditions they're in. And so putting this all together and building a model is a big gap there. At the same time, the other one is integrating AI models within the existing systems, right? A lot of you are working closely with healthcare, and we have different platforms. They are health record systems, medical record systems, and then the way they are designed are not very friendly with AI and data collection. Different platforms have different ways they are collecting data. So making sure that it is all a part of the flow, it's a long time thing. We'll have to work towards it, making sure that we make it AI friendly and then work towards it. And the last big reason we see these gaps is the regulations and making sure the way we are doing it is proper. Because with data collection and how we are leveraging this data, using this data, there's a lot of consent that is required, permissions that is required, the compliance that is required, and our legal frameworks, not just us, all over the world. We're AI moving so fast, we're still working towards it. So these are a couple of things I see.
Thank you. Yeah, very, very clear. Great answer. So data, that integration piece, that regulation piece. Glenn, Natalia, you both have experience on that product side. Do either of you want to speak to this?
Yeah, absolutely. So I do believe there are multiple gaps depending on the perspective from which side we're going to approach the problem. So we do have a patient perspective, and there are more major topics such as security, but I think there's also acceptance of the technology that we should speak about. Because AI is still a new topic that just emerged, and myself as a typical millennial, a person that came across from accessing the internet to the cell phones to the AI, which is next revolution, there's still this skepticism to this technology. And yes, it requires the double checking definitely on both sides, but the same happened when Google was invented, and you still had to check your sources of the information, and the same happens when it comes to the AI. From the healthcare perspective, I mean, our case is a little bit different, and it's more software device based, because we concentrate on not as per se diagnosis, but bridging of aestheticians, medispas into the healthcare dermatologists for flagging lesion skin changes. Now, the reason why is because here in Canada, our timelines to see dermatologists are from 3 to 6 months, with some reported in provinces that are more rural up to 12 months. And that's a little bit too late. So we have to close that gap when it comes from flagging the issue on the skin, from the referral to seeing actual dermatologists. From the clinic perspective, in this case, is a role-based access. Who has access to which information, right? Because we have to follow all the regulations, as Saba mentioned. But also such trivial things as like UI or UX, the way how you actually operate that technology, the way how you see that software. Too many clicks can be very confusing and might delay the adoption of the technology. Security is also questionable, right? Because when it comes to the confidential data, any updates, any information, in a perfect case scenario, you would rather store it locally on the computer than accessing multiple servers, for example, right? So there's that case here. And when it comes to technology, from our perspective, when it comes to the development of the product, is that the models are changing constantly. It's like almost every week you have a new model entering AI. So you have to keep up with those changes. Also, the access to the data set. In our case, we actually analyzing full spectrum picture of the face. It's not just the zoom in on the skin, but there are two layers to it. And that data set can be biased as well because, for example, we have different Fitzpatrick scale when it comes to our skin tone. So all the data sets are catered to people with a fairer skin. And then there's that bias when it comes to darker skin tone. And we approached that issue in a real field when one of my friends who's Jamaican, he has a darker skin tone, and the UV light and the analysis were not overlapping. They basically said there are no changes to your skin, there's no UV damage, which wasn't the case. So there's that bias as well when it comes to different groups. And then, of course, governance. Who is responsible for what, and how we're going to utilize that technology?
Yeah, excellent points. Comprehensive answer. Thank you for bringing up, re-emphasizing the data piece and the bias mitigation in the data piece, re-emphasizing that security and regulatory and governance aspect, but also really looking at the user's perspective and the user acceptance and just that trust of the product, right? Also, how user friendly is it? Even if we do get that trust built in and we get the rollout, does it have too many clicks? Is it easy enough for them to actually get into and use? Yeah, really excellent points. I just want to open it up to Glenn or Jaspreet if you want to build on either of those.
Yeah, just two things. From my perspective, one is just workflow, right? I think that's the biggest problem on the provider side is everybody already 100 miles an hour, even if it's going to make their life better. The lack of transparency and that's not going to get any better. You listen to somebody like Elon say, we don't really know what they're doing. The models are doing things we don't understand, right? I think we all have to understand created a technology that's actually a little bit beyond our ability. And so how are you going to regulate something that it's different than regulating something machine learning where you put in the thing, you're going to always get the same out. It's completely different with and so how are we going to regulate that? I think those are some big things that are staring us in the face.
Yeah, very valid points. We do have, so I think we'll come back to some of those workflow issues, but on that black box phenomenon, on the lack of transparency, on the regulatory, but also the design requirements, right? A lot of people are talking about explainable AI, XAI today as one of the solutions, and it is one piece. But really, if we don't know if we don't know how decisions are being made, and if we don't know how these models are getting to the result, the output that we actually see, we're back to that trust, security, and regulatory issue, and we really do need to solve for that. We may get to this further in this conversation that, the hype around and the rise of agentic AI really does heighten those risks and exacerbate a lot of those risks of how the chain of decision making is happening. We've seen all kinds of patterns where, there are a lot of risks there. So we may get into that conversation a little bit as we look at how to future proof the AI revolution, but particularly AI in healthcare. But before we jump forward, Jaspreet, did you want to weigh in as well?
Yeah, I'm just going to add that certainly we're actually seeing evidence of these gaps actually. If you look at the data, 80% of AI projects actually fail to scale beyond just that pilot phase. And I was looking at some metrics. I think only about 24% of healthcare professionals where AI tools have been deployed actually feel like they've actually received training. So I think one of the other critical gaps in this space is really that AI literacy. And I think that will help resolve some of the issues we have with the regulatory uncertainty as well, because I think clinicians are also afraid to use these tools just because of what everybody said. You don't really actually understand why it's giving you the information it's going. But furthermore, you actually don't know who's liable at this point. Is it the vendor? Is it the clinician? Like who actually would get in trouble? So I think there's some critical gaps there that, AI education and literacy might be able to supplement in the short term at least.
Yeah, great points. Before we move from this topic, does anybody have an example of, promising AI tools that they've seen fail to integrate into, well, let's go back to Glenn's earlier point, into clinical workflows or into adoption, maybe from Jaspreet's perspective?
What I will say, I've seen many tools come to market that probably don't have any place in the market. I think I've seen a lot of that. I've seen a lot of clinical tools come to market before, in advance of really understanding the technology, understanding how the tool is making its clinical decisions. I have seen a lot of that in the last little bit, actually. A lot of, smaller organizations that are kind of navigating the gray. I would say that's what they're doing because they really just don't know what is permitted and what is not permitted. So we're seeing the growth of some solutions that I don't actually know where they're going to end up. I'm very confused sometimes as to whether things are going to be categorized as true medical devices in Canada. Like it is very confusing to understand where that regulatory framework kind of lies. So I think what I'm seeing is, yes, I'm seeing the development of very, really great practical tools. Like I was reading an article, I think in Fraser Health in BC, they created a tool to help with discharge, and they were able to double their discharge capacity from like 300 to 600 patients a day, which is amazing. But at the same time, I'm seeing the evolution of all these tools that actually get me very, very afraid, because I think that pharmacists or clinicians will just start using them without really understanding the implications or even obtaining appropriate consent. I think we're even that is limited at this point.
Yeah, really valid points. Really interesting perspective, right? Where I was thinking, why do they fail? You're saying, you know what, maybe we're not ready to push some of these ahead yet. There's a lot of gray areas. There's a lot of things that we need to get to check first. I'll circle this back. So I'm going to go back to Glenn. I'm just going to phrase this a little bit differently, Glenn. So how can AI systems be designed around how doctors think rather than how engineers and data scientists build?
Is that there is a lot more thoughtfulness in how the AI systems are being developed than maybe how, for example, electronic health record systems. They were very much developed from a sort of engineering perspective and from a business and billing perspective, and really left out the clinician. So we had to deal with a lot of crap, for lack of a better word, that really slowed us down. I think we're on a better trajectory this time around than we were sort of with the big technical developments in there.
Great. And I wonder, Natalia, if you wanted to weigh in on that as well.
So when it comes to the workflows, I think one of the things also to remember is that every time you have to record medical history, right? Especially when it comes to the clinics. And we specifically, when we work with Medispas, we work with nurses. And of course, US has a little bit different regulations from states to states when it comes to medical directors who can actually sign off some of the works. But there's also the part of an integration to other tools, right? So it's not just the closed system that you're operating in, but it's the outside system that you have to integrate with, and you need to make sure that you're also compliant while securing the data. So I think that that's one of the challenges as well. And there are multiple providers today. Now, when it comes in general to AI companies, I mean, I do agree with Jaspreet. There's so many companies popping up on every corner, as I would say, when it comes to the healthcare, finance, and every other industry we can imagine. But I do believe that healthcare as particular has a very strong framework and already regulations in place to actually better govern the way how AI is implemented. Even when it comes to the treatment, diagnosis, or medical devices, a very simple example, and this is outside of the medical field here, but when I'm going to use as a company, for example, as a description, lash growth serum, despite the fact that I do not use any prescription drugs, in general drugs, I'm classified as a drug based on the claim I made. But if I'm going to say longer looking lashes, lash serum for the longer looking lashes, that's automatically cosmetic. So there is a common glossary of terms that we use in the industry that we have to obey to. But once again, this not only have to be aligned with the frameworks that we work in, but also there needs to be governance to it, because there's so much overuse right now that it's not compliant, that once again, we need a body that can align with the future of the technology in the healthcare.
Yeah. Thank you. Excellent example. And as you were talking, I was thinking, well, so there's the benefits of a highly regulated industry that you should be able to safely follow, the guardrails. And if you are, it actually should speed your time to market. But as you were talking, I was thinking, but what about enforcement, right? How do we know? How are we checking? How are we governing? Does anybody want to speak about governance and enforcement from your perspective a little bit more, what you see happening? We have a segment earlier in this series where we talk about the EU, where they really are already implementing fines. They're giving warnings. They're giving timelines for people to be compliant. They're a little bit ahead of most of the markets that we look at. But we have a lot of people in the Canadian market on this call, as well as the US. Does anyone want to speak to that?
I can certainly speak to the fact that they're in Canada as well, and I don't remember every single case right now, but we have seen the beginning of, cases where, like, for example, I believe the privacy commissioner opened up a case against OpenAI, for example, just, considering privacy and all those pieces and data retention. So I think there are already examples in the Canadian system of companies that have had repercussions. Like Natalia mentioned, there are some good governance in place. Like you do still need to comply with the PETA, and in each provincial jurisdiction, you still need to comply. And there's a lot of good guidance in those those regulatory frameworks to support as well. So I have actually seen cases, and maybe Saba, you've seen as well, of companies getting in trouble even early on.
The FDA really hasn't decided how they're going to regulate or if they're going to regulate, and so we're all a little bit developing things without knowing what the rules really are, and so it's an interesting place to be. I think perhaps it's a good thing because they're allowing us a little bit of leeway to develop without too much. But eventually there will be rules, and so we're all trying to figure out what we think those rules are going to be, and so stay tuned, I guess.
Yeah. I completely agree here, because rules and regulations, it's quite a gray area right now, because if you go look at these regulations, documents and everything, and it's very high level. What you should do, you shouldn't. And with an AI, every use case is different. How you're approaching is different. Every day you have a new model, new way to do things. So it's very confusing right now. We are getting there, but there are gray areas, I would say. And as a developer, we try to make a decision based on our own understanding, but there are gaps.
Good. Listen, I think that we have successfully covered what those core gaps are today. Some of them we might see how they're going to be solved. Some of them we have no idea today. I want to shift our focus to say, we're having this conversation in 5 years. It's 2030. What's the headline that you want to see about AI in healthcare in 5 years? And I want to give everybody a chance to answer. So let's start with Saba.
Sure. So one thing we are focusing on as developers are people who are working on AI, trying to make it more responsible and ethical. It's the part where you already mentioned transparency, explainability. Even in the latest model, you would see we're trying to work on the way and understand how AI is responding. So the thought process and everything. And that's where the big gap is, because AI itself is a socio-technical issue. It's not just technology. Whatever decisions are being made, it is impacting humans. So it's very important that we understand how it works, because there is a huge knowledge gap. The people who are developing AI and people who are actually using it, um, they both need to understand how it works. And at the same time, people who are making these rules and regulations, they need to understand how AI works as well. And that is the big gap. So even if someone is on the other side and they are seeing the outputs of AI, if we are at a stage where they can look at AI and see, okay, this is why it gave me this answer, that's, I would consider a huge success for us. So it's not just a black box. And we're seeing that transition as well. A lot of companies, especially in healthcare and financial sector, they're moving towards explainable models. And they're okay to not they want accuracy, but they're okay with a little less accuracy if they have explainable models. So we are seeing those trends, and hopefully we will get there.
Yep, excellent answer. Good perspective. Let's go to Natalia next.
What I'm looking forward to, I believe I totally agree with Saba when it comes to that alignment on each of the sides, when it comes to implementing AI, that acceptance of the AI. But truly, what I really want to see is that we're going to remove also that burden from healthcare, because I don't think anyone realizes how many reports you have to write, and I believe that's what Glenn's is doing, but I'm not sure, so I don't want to jump in here. But one of the things that why AI already has such a wide acceptance is because it already improves our day-to-day life. So definitely I would love to see the acceptance on the AI side, but at the same time, I would like to see that there's that backup behind it, that we do not just rely on that data, but there's that transparency that we mentioned before when it comes to how those models are executed. What is the source of the data that we are training them? How reliable are they? And there are already some measurements based on which, for example, like AUC, we can already measure that. So it's already there and it's getting there. But I do believe I would love to see the acceptance of the technology. I would love to see that burden removed from the healthcare. And from my perspective, I would love to get that referral time to dermatologists to see it if you have any skin lesions, to go down from those 6 months or 12 months, and especially in rural areas that do not have the same access to the healthcare as other cities.
Yeah, excellent. So Glenn, from your perspective, it's 2030. What's that big headline in AI healthcare that you want to see?
Yeah, so the first thing I'll say is, there's a great quote about technology that says we tend to overestimate technology will do in the short run and underestimate what it's going to do in the long run. So I don't know if this is 2030 or 2040, although I suspect with the speed that it's going, 2030 far off. So the first thing I would say is AI is really two separate things. There's Gen AI, and there's everything else in the AI space, all the machine. And so I think the machine learning space is going to continue to be what we see already, which is its tools, and they will follow a path that is, sort of what we've been following. But I think Gen AI is going to follow a very different path. And so I'm going to lay out what I see coming. I think by 2030, we will have autonomous AI agents that are providing help, and doing it without providers in the loop. And I think that we'll have add-on tools to those, whether those are ML tools or whether they're Gen AI tools, that will extend that even further than just sort of basic primary care. I think you're going to see sort of a lot of the things and counseling, other things. You're just going to see that extend into a lot of other parts of medicine and healthcare. And I may be far off on that, but I see it coming already and the stuff that's being built in the background that nobody sees yet. And the thing have providers in the loop right now, but you can imagine those providers pulled out and it would still work just fine. And so I'm excited about what's coming in 2030. I think you're going to see that Gen AI is going to be regulated at and is also going to be considered more a colleague than a tool. The other parts of AI are still going to be tools, but I think you're going to see Gen AI become more like a colleague. And that's very weird for us. I don't think anyone really, I don't really understand the full scope of what that's going to do, but that's what I see coming.
Good. And Jaspreet.
Yeah, I think my thoughts more also go to like the organizational changes that I expect to see, like the transformation changes that I actually expect to see. But fundamentally, I think what I would love to see in the headlines is that, of course, quality of care improves for patients, but also on the clinician side, that the quality of their life improves as well, that these tools do exactly what we want them to do, improve patient lives, but also definitely improve the clinicians' lives. And I think for healthcare organizations, I'd hope by 2030, we've figured out the AI literacy gaps and that there are full suite workforce development programs in the AI space, that the financial modeling is actually there as well, that we figured out all of that piece to ensure that technology continues to grow. And I think I'm hoping to see that there is cross-sector collaboration happening and that co-design really kind of being an active component of creation, and not just within specific clinician silos, but across various clinicians supporting collaborative care.
Amazing. So going a little bit more specifically into some of your areas, I want to ask Saba, what would be one change that we want to see in AI hubs to get to this future? I know your future focused on transparency and explainability. It doesn't have to track with exactly that answer, but there's so much that the AI hub that you're in today does offer the community. What's one change that would improve the offerings?
Okay, that's a tough one. We are working towards several of the things that we discussed today. A couple things that we're trying to do. One is making sure that we're trying to integrate the latest technologies. The other one is training the next cycle of AI implementers and developers, and that's very important because it's not just technology that you're developing. One thing we really emphasize on is the human in the loop approach, especially within fields like healthcare. Help them guide where do you need AI and where you should keep the human. And that's something we work towards as a part of our advisory services as well, right? Because it's it's a it's a good tool, but it can be dangerous as well if you don't use it well. And it's very important to teach our next generation, who are going to be the implementers of AI, that how to use it right. So that's something we are focusing on, and that's a big change I would like to see within these hubs, to train our students, to train our next cycle of developers how to use this tool and how to integrate it responsibly.
Excellent. Natalia, over to you. So you've brought up equitable access, particularly in rural environments. I want to ask you, looking at 2030, how do we ensure equitable access for healthcare and AI?
I mean, the part about equitable is dependable on the side that we talk about, because what is being equitable in that case? Now, do you mind just rephrase a little bit question for me?
Sure. So I think what we're talking about here is so there is an inequality right now, looking at urban versus rural environments, right? So how long does it take to get access to healthcare, how long are wait times, how many kilometers or miles, depending on where you are, do I have to drive to be able to access healthcare? Is there the ability, and I'm not trying to give a leading question here, but I think a lot of people see a hope and a promise that AI can be an equalizer, right? That we could start to remove those geographic barriers, that we could start to normalize wait times, that, that there's this real promise there. I don't know if that's the answer, but I think when we look at some of those inequalities in access,
You're quite correct. So one of the topics, as you mentioned, the uneven access to the healthcare, right? So I can tell from my own experience. I used to live in Toronto. I was able to get through my family doctor to gastroenterologist over the time of 2 weeks. And when moved to Niagara Falls, it was 1 year. So there is real life inequality when it comes to big cities and more rural suburban areas. And that happens, and those stats can be supported even by looking at the data, right? So, for example, BC, British Columbia here in Canada, the access to dermatologists is given to you from the referral point to seeing dermatologists in 3 months, which is great. But then when we're going to look at Nova Scotia, we're talking sometimes about 9 months. And 9 months for skin cancer, where 1 in 3 people in Canada at one point will be diagnosed with skin cancer. That's quite a time. So we definitely want to actually decrease that timing. But then once again, we do know that when it comes to dermatology, and that's where the bias comes in, it's not just the rural versus the major cities and the unequal access to the healthcare. In some of the countries, it also means a financial burden to some. I mean, here in Canada, we have a universal healthcare. But for example, in the US, we do have all type of benefits that can cover that part. But sometimes we want to make sure that people on the low income side also have an equal access to the healthcare. Then the third part that we have is that in the dermatology perspective, when it comes to the skin tones that I mentioned before, so all the data available is the data between the Fitzpatrick level 1, 2, 3, which is a fair skin. Anything above 4, it's very, very hard to access. So a lot of companies have to step up because we don't have, even dermatologists do not have that access, or there's a lot of misdiagnosis when it comes to the darker skin tone. So we want to close that gap as well. So when we talk about equality in that sense, yes, it can solve a lot of challenges that we're facing right now in a quite fast way.
Thank you. That was a great highlight. Moving to Jaspreet. Jaspreet, you're looking a lot at organizational change and change management. What would interoperability done right look like in an AI-enabled healthcare system in the future?
Ooh, interoperability. Okay, I think if you look at just even within an organization, right? I think any healthcare organization that's looking to implement AI, it should be cross-department. So let's start there. I think if you start there, that'll give you basically the framework of what it would look like to maybe work with other healthcare providers as well. So, the team should be clinicians, it should be your IT, it should be your HR, it should be everybody. It should be one person from each department really kind of supporting AI implementation for the future. I think that's where really a lot of our solutions probably lie in transformation, in that it be collaborative, not only trying to get rid of the silos in healthcare, so not only doctor, pharmacist, but even interdepartmental, meaning clinician, IT, HR. So it's cross-collaborative in many, many different ways, I would appreciate.
Yeah, excellent. So this is for Glenn. This seems to come up in every conversation, at least today. Let's say in 2030, maybe it doesn't. Let's look toward that future. How do we ensure AI enhances, not replaces, humans and that human relationship in care?
Yeah, I think that's a really interesting question moving forward, right? Because I think right now the good news, at least in the US, we are so short of providers of all kinds that we actually to help scale the providers that we have in order to adequately take care of the population. And if you look worldwide, most of the developing countries don't anywhere near to take care of their population. And so using AI to provide care, I love the question about geography and inclusion, right? Because using AI to be able to give people, basically everybody with a phone, can suddenly have access to good medical information that is tailored directly to them, which happened. So I think right now it's, it is likely that it is going to enhance our providers. It's going to scale them. It's going to continue to be a provider in the loop for a period. Long term, will it replace people in a lot of jobs? And I don't know here, but I think it's going to come to everywhere, and we all we have to face that fact a little bit. The good news is I think it's going to create a lot of new things that we can do. If you look at all the revolutions in the past, right? The internet revolution, and before it, the industrial revolution, they have all created whole new categories of work, new categories of jobs, new ways to make that nobody even dreamed. And I think the same will be true with AI. I mean, I'm personally hoping that my AI can be in the Optimus robots that are going to Mars and take care of the. So, but I joke a little bit, but what I'm saying is there will be things for the humans involved, and we just have to be open to that. Not be like of old, that we're not adopt machinery because it might take away a job. We have to be open, forge forward, and build and expect and hope that will lead to improvement that will for all of us.
Yeah, well said. Okay, so we've looked at some gaps that we still have today. We've looked at some real opportunities and what the ideal future would look for. And Glenn said it well. I don't know if it's in 5 years, 10 years, 15 years. This is moving very quickly, but we're just looking forward. So I want to open this up more broadly. There are some bold moves that we probably need to take now, that we need to take today to get to that future. What should the healthcare community stop doing immediately when it comes to AI? And whoever wants to answer this.
I mean, I can take it initially. I think because my thought of mind always goes to the personal liability that resides with that individual clinician at the end. So I do fundamentally believe that, I love that we're seeing so much innovation, but I really do think we really need to understand the regulatory requirements. Organizations are implementing AI tools without understanding PIPEDA and Health Canada's medical device regulations, or even the provincial variations in privacy law. So I think we start there. First and foremost is ensuring that the tools that we are developing are compliant. And I think we stop implementing AI solutions where we haven't considered co-design and we haven't considered change management initially prior to launching. Yeah, I think we stop doing those two things. It'll put us in a pretty good position.
Yeah, I agree with Jaspreet on what she
answer. Go ahead, Glenn.
Oh, I was just going to. I agree with what you said, and I would add a couple. One, I think we're so siloed by health system and by providers and by different silos. We need to stop thinking in silos because AI is really built to be across all silos. And so if we can use it instead to really focus on what do patients need and what do providers need to do the best for patients, I think that'll be great for all of us. So stop thinking in silos, start really building for patients and providers.
Agreed. Yeah. Another thing I would say is standardization to some extent. For instance, it's not just the workflows, but the equipment you are using, right? The data you are collecting, the models you are training. The equipment differs from clinics to clinics. So how do we address that when we are using the same models? So things like that. Other thing I would say, and we might need to consider, is the continuous training and maintenance of these AI solutions that we are implementing. So it's not just a one-time thing. We need to understand, we need to train our resources, and then we need to keep updating those models to make sure it's working properly. Because if we're not educating our resources, we are going to see those gaps.
Thank you. And I appreciate how many of you started with what do we need to stop, but then added in what do we need to start so that we get both sides of that question answered. So last question for all of you. What is a personal commitment or call to action that you will take forward from this discussion or from the work that you're doing? Let's go to Natalia first.
Well, there's many actually calls to actions in my case, especially since we divided the project into multiple phases, and simply because when you operate in healthcare, there are different systems that you have to and frameworks that you have to operate with. And for our case, we started with skin AI analysis in the form of hyperpigmentation, wrinkles, right? So it's more of aesthetic side. The second stage that we're implementing right now is the stage where we actually want to flag any lesions that are occurring on the skin, and then eventually move into medical system when it comes to the classification of the device, right? So for us, there's a lot of calls to actions, but I think that if we're going to take steps in that pattern, in that way, we can focus step by step on what it matters when it comes to providing the data set, polishing up the models, then incorporating all the compliance sides, which already are working. But when you want to enter fully healthcare, that's another step up here. But this way, we don't have to rush through it. We can think through every step. So for us, calls to action is just to move forward ahead with our project. We already have in the field our devices, but bridging the gap between estheticians that see every single day multiple faces, connecting them to the healthcare, building those ecosystems that can cooperate with a healthcare while not doing the diagnosis on the side of the esthetician, because that's not how it's supposed to be. Although I'm pretty sure there's many new AI startups that probably could do that as well, but that's not the way to go to. But bridging the gap in environments and between those industries that are close related to each other, and a lot of nurses, we have a lot of practices like plastic surgeons that are working in those spaces, and bridging that to the treatment for the patients while narrowing down those timelines, that's the biggest call to action. Now there are multiple steps to it. But that's the biggest one.
We can pause there. Thank you. Jaspreet, one personal commitment or call to action, and let's keep it to maybe a 30-second answer.
Yeah, and I think my entire career has really been focused on supporting clinicians in regulatory compliance and ensuring they don't get in trouble. And the data shows that only 16% of healthcare companies or healthcare systems actually have developed a governance structure. So I think my personal commitment in AI literacy and advocacies is to support, more organizations developing that governance structure so that they can employ really great tools like Natalia has developed.
Beautiful. Saba?
For me, it's I started as a developer. So when I started, it was more like, oh, I'm building something new and all that. But my focus has changed. Now I'm more focused on how to build it responsibly. To so because it's going to make a difference, right? We don't understand small things like you build that model. What if a patient requests you to delete their data? How are you going to handle that and things like that? So for me, it's more about responsibly building these solutions.
Perfect. And with our last minute, Glenn, your personal commitment or call to action?
Sure. I think for me, it's stay focused on building things that make patients' lives better. We want to do the right by providers and everybody else, but in the end, sort of going all the way back to Hippocrates, it's about the patient at the end of the day, and we need to focus on making sure that we're building things that are going to create better lives for them and better health. And so that's my call every day.
Excellent. Said truly from the words of a doctor, I feel like. So as we close for today, we've heard throughout this series that AI in healthcare is not about replacing the people. It's about reconnecting them, reconnecting researchers and clinicians, patients and systems. And that future that we want for 2030, it doesn't just arrive by chance. It arrives by design. That design starts with each of us asking, how can we make it not just smarter, but more human in the way that serves the care that we're looking for. And I'll add just a takeaway from this series that no one of us can transform healthcare alone. The real progress does come from collaboration between labs, hospitals, public, private, between vision and implementation. So I hope everybody on this call and listening will keep building those bridges together through learning and through the connection we've achieved here today. And I want to take a minute to thank each of our panelists for joining us today. Your insights and experiences have been invaluable. And to all who have joined us on our learning journey, thank you for sticking with us in the AI Revolution in Healthcare series.